All right, good morning, everyone, and welcome to our webinar this morning, part two of Worry and Anxiety, using evidence-based strategies to help children and adolescents with Dr. Erin Berman. I'm Mary Beth Harrison Cunningham. I'm the manager here at the Family Resource Center, and we're very, very excited to bring you this start of this wonderful webinar. It's such amazing information. But Dr. Erin Berman is here today. She is a clinical psychologist at the National Institute of Mental Health in Bethesda, Maryland. She received her clinical psychology doctoral degree from Rosalind Franklin University, the Chicago Medical School. Her clinical training continued with attending the Boston Consortium of Clinical Psychology, where she was a Harvard Medical School fellowship recipient. She completed postdoctoral respecialization in child and adolescent anxiety disorders at Temple University. Her main area of interest continues to be in cognitive behavioral interventions for children, adolescents, and adults with anxiety disorders. Thank you, Dr. Berman, and welcome this morning.
Great. Thank you so much for having me. And thank you all for coming to listen to a very important topic. We'll talk about worry, anxiety, also just stress in general, and what you can do, more importantly, as caregivers, teachers, just the adults in all the kids' lives, and honestly, what we can do for ourselves as well. So I know we will have a Q&A section, and I work with a wonderful social worker, Kayleen DeHaut, who will be helping me. Please, Kayleen, interrupt me if there's a question that is kind of relevant to the slide that we're on. As you all know, I work with kids. I don't mind being interrupted. So let's see. Basic stuff. I have no conflicts of interest. These opinions are my own. It is also, though, many of these different strategies are things that I'll review what research studies they come from. So it is, again, these are skills that we know tend to work in a variety of settings. So I'm going to give a little bit of an introduction on, most importantly, that we understand, childhood is a huge age range, right? And I think that was a part of this presentation, is we want to talk about all age ranges. And so it's going to look stress, anxiety, worry. I'll go through all the different ones are going to look different in each child. Why do we want to differentiate as the caregiver or the teacher if it's stress, anxiety, or worry? Is that'll determine what are the better strategies to use, right? So I just like these images because I think, anxiety disorders and stress disorders are usually internalizing disorders, right? So meaning they're more in our heads, we're thinking about them, versus kind of externalizing disorders. When we talk about externalizing behaviors, we're talking more about, hyperactivity or, yelling or screaming. And a lot of times stress is very quiet in the body. And so we'll talk about what are the more subtle symptoms that may indicate that your kid or even yourself may be experiencing stress and what we can do about it. So just to give you a big general, background of what the prevalence of these are disorders. So this is a depressive disorder. This is anxiety, so excessive worry about what other people think of you, or worry about the future, or worry about your safety, right? And then we have behavior disorders, which are disorders such as attention deficit hyperactivity disorder. And it looks at kind of where is the more typical age range for these things. As we can see, for depression, it tends to hit its peak about 6% of the population on the ages of 12 to 17 will have that occurrence within a year's period, right? For anxiety, again, also the 12 to 17, this makes sense developmentally that you're going to see less in the youngers, but it is important to look at 6 and 11, it's still pretty prevalent. Anxiety disorders in the little ones. And then obviously the behavior disorders, again, are kind of physical acting out or hyperactivity, inability to focus and concentrate, being oppositional, right? And irritable. You're going to see that more in the younger age range, right? The 6 to 11. So just to get an idea, depending on what kids you're working with or your kid's own age, what would be more typical to be seen depending on developmental level, right? That is, again, what's so tricky about kids versus adults is a 3-year-old who's anxious looks very different than a 17-year-old who's anxious, yet we kind of put them all in the same pile. So I've done this slide last time. There'll be a few slides from last time, but why this one is really important, again, is to figure out your strategies to work with who you're dealing with, right? Whether it's an adult, whether it's a teen, whether it's a preteen, each brain is very different. And I know when we think back to either our own kids, the kids we work with, a 5-year-old in that class is so different than when you're sitting next to a 10-year-old, right? 5-year-olds are more impulsive. They're walking around. Their verbal skills are less than formed. And how do we know this? This is all, science and brain development, right? So this is a really neat image below. We can see the parts of the brain that are less fully mature, right? Those are the red and the yellow parts of the brain. Now, again, we don't have to know the whole brain, you don't need to know all the different, parts, but what we're looking at is if you're looking down on top of my head, right? So like that. So obviously when it says the 5-year-old or preteen, that part is the front of our brain, like right here. And as many of you probably know, the front of our brain controls executive functioning. I always think the way we can remember all the things that executive functioning does is think of an executive assistant, right? They manage so much in an organization, right? They are taking phone calls, they're making appointments, they're booking travel, they're organizing a schedule. It is a lot of multitasking, right? We can all relate. That 5-year-old brain is not making appointments, making their bed, cleaning up the dishes, and then remembering to, finish their coloring homework, right? So it's really important to know where the brains are. And we do think, oh yeah, okay, so by preteen, they should have pretty good forms. Look at the front is still not that great in terms of fully formed, right? So they're not going to be great at planning. We get frustrated sometimes when our kids cannot organize our schedules or remember their homework. Well, in the preteen brain, it's still forming pretty well, right? It's not fully formed. And the 5-year-old, of course, we don't expect that. But knowing what to expect with the preteen and even the teen. Do you see that green? There's still plenty of green up in the front in that teenage. Not till you're about 20 years old. And really, it depends on sex, right? So male versus female. And usually the females are a little quicker to develop those frontal lobes. And usually it's maybe not till about 25. And we also, know that data with an individual that may have anxiety disorder or ADHD, it may take even longer or look different, right? So what do we need to start to teach them at a young age is, and I think the easiest way to do it, if you're good at it, not all of us are, I'm, not good at modeling, sometimes planning or prioritizing for my kids, is saying things out loud. Kids learn by what you say and what you do. So knowing that just these basic things are still forming, hopefully gives us a little, kind of grace to the kids, and also helps, figure out how we're going to say things and do things so kids can cope with stress and anxiety. So what are common causes of stress, right? So stress is, we talk about, has an event, right? Something that is happening that's causing an increase in either worry or irritability, or just general upset and stuck in this kid's brain. So what are the typical ones that we see for kids? And that is the spectrum. We're going to say from our 5-year-olds to our school age, our 5-year-olds to our 18-year-olds, 17-year-olds. So moving school does have an impact. Even if the kid is pretty flexible, it's still going to know that, if you're moving schools, that's going to cause an issue of stress. Or I was thinking I had unexpected teacher changes. So one of my more recent patients was doing very well with his separation anxiety disorder. He was doing very well with his attention deficit. We had a lot of skills in place that he had practiced over the summer. With his school, the same teacher he has for 2 years in a row, right? So he was expecting the same teacher, which again was standard in all of the classes, but something happened family-wise for that teacher, and they were unable to kind of fulfill that role in the fall, right? So they had a week with that teacher, and that changed. That sent all of his anxiety, ADHD up again. So knowing that, where is our baseline? Kids with mental health disorders, disabilities, add a little stress, and it's going to change what you see. So moving schools is a big one. Teacher, in relationships with teachers, housing instability. Obviously, if there's stress in the home, it's going to be harder for the kid to focus, right? Or feel as secure, but it's not an uncommon issue or stressor nowadays. Exams, so now we're getting to the older ones, or even the middle school, or some of my little ones, my elementary schools, but hopefully they're not stressing so much about exams. peer pressure, and that's, coming from any age, right? Like even the little ones could have some level of peer pressure when it comes to, doing things or playing or being in sports. Negative thoughts about themselves, which that will tie into social media very nicely, right? As social media, thinking negatively about yourself only increases our stress and then reduces our ability to cope. So knowing that when we have these things, how can we change any things in the moment? So when we have stress, we figure out what we can do. Bullying, teasing, this is an important one to always figure that one, if that's what's going on, because I like to involve then either extra adults, meaning teachers or counselors, because it's not something that the kid can just think themselves out of, right? They're going to need extra support. Schoolwork obviously can cause all kinds of stressors for a variety of reasons. That's why I want you to always be thoughtful about, what is your child coming into the schoolwork with? For someone with ADHD, it's hard to sit and focus, right? Chronic illness. Many kids live with something to the effect of diabetes, other chronic illnesses, which will up their stress sometimes, family issues, parental stress in general. So if we're all stressed, caregiver stress, then it's hard for us to cope, right? And that's not weird. There's nothing wrong with us having it. It's really important to notice when these things are happening and how do we start to address them as fast as we possibly can. And social media, obviously limiting that to a wonderful degree can be very helpful. This is CDC data that just looks at the general population. These are ages 5 to 17. It is interesting data because it talks about children without disabilities or with a disability, and how during their age range of during their childhood, how many experience a stressful event. How we're defining a stressful event with this study was either financial instability, parental incarceration, or parental mental health issues, right? And we can see that about good news, about half the kids, a little over half, right, do not of the kids with a disability, but you can see that difference between without, right, versus with, right? So having that disability does put you at a vulnerable to have more stressful life events. But about, anywhere from 60 to 80% will not have no stressful life event, which is great. About 10 to about 17%, you see the increase in individual with disability will have one stressful life event, and then 8 to about almost 18% will have, again, 2 stressful life events, just to know what kids are dealing with. And when these happen, this makes kids more vulnerable to needing more support and more coping. So what do we know? How are we going to know if a kid is stressed or anxious? And slowly we'll talk about the difference between stress and anxiety, but I'm starting mostly with stress, right? And stress comes from an actual event. So you see them worrying before and after events. So, before they go to school, you hear them talking about not wanting to go. Or when they come home, they're talking about that kid in their class, right? So what is it? And is it a specific thing that continues to pop up? A big hallmark is irritability, right? So we think, oh, they're just being cranky. Oh, they didn't sleep enough. And we'll talk about, you should have your basics always covered. Maybe they didn't sleep enough, but many times irritability can be a sign of stress and anxiety. When you have a kid who's more regularly calm or more regularly less irritable, that can be part of it. Problem sleeping is a huge one, and that is a massive cycle that really perpetuates an inability to manage their own stress. And then also as a caregiver, it's very hard if you're not sleeping well because you're managing a kid that isn't sleeping well. That can be compound, right? So you'll see me really focus on going back to basics, making sure there's a good sleep routine and good sleep hygiene, which we'll talk about in a little bit. Problems being alone, so being scared to be in certain parts of the house or the apartment, not being able to relax or have fun, right? Just can't chill out and read a book or even play that video game. They're constantly either fidgeting or moving or feeling nervous about what might be happening, right? Inability to control emotions. So you see, emotion dysregulation. So where they're just screaming and they can't calm themselves down, even though you try and intervene, and it doesn't have to be, and it's usually a prolonged when we talk inability to control emotions, because we all fly off the handle or get a little stressed out, or I know I overreact when I'm driving for sure, but how long do we stay up there, right? How long is that sitting in our body And you can see that if a kid's having a long time, if it's taking, 10 minutes to calm down versus hours, right? That's a big indication that there is stress and possibly an anxiety disorder or a depressive disorder or something under there. Self-conscious. So, everyone thinks about themselves and what other thinks of them. Well, not everyone, we'll say about, I would say 95% of the population. But really being preoccupied what someone says or how they're dressing, or, and we'll talk about how social media does not obviously help with that many times. Panic, so real physical symptoms, that goes with freezing, right? Or when we talk about panic, fight, flight, or freeze, right? So they're just really struggling with their ability to do things. It's common in kids who are either social anxiety or more on the shy side, right? You have them in a classroom and maybe they need to say something to the teacher, they need to use the bathroom, but you see that kind of deer in headlights, which can be a sign of anxiety. Worry, so thinking a lot. Butterflies or more physical symptoms, right? Problems concentrating can obviously be, connected to ADHD or really stress, right? So if you're worried about, changing schools, or you're having issues about where you're going to live next, it's really hard for you to focus maybe at school, right? And we'll talk a lot about physical symptoms. That can be one of our first indicators in kids and even in adults that we're experiencing excessive stress and anxiety. And I'll go on to that next. So if anyone's seen my talk, I've done this before, but it is so important of a diagram, and it may be hard to see. I may just be aging that I can't see that so small, but it's really showing that, our amygdala, which really directs kind of our central and autonomic nervous systems, right? So it turns our body on. Our amygdala is the section of our brain that focuses on anxiety, right? And if we're feeling anxious, it really turns on the central nervous system and autonomic. And so when we're stressed, when we're anxious, our body starts to do all kinds of things. This was originally obviously created in our bodies to kind of conserve energy when we might have been in danger. So to kind of shut the body down, so we didn't really need to eat if we were in mortal danger, right? We either want to run away or kind of freeze and hide if we were in mortal danger. But what we've seen in the science is that it's no different if you are, feeling stressed about, how you are perceived excessively at school, or you're scared to get up and present in front of the class, or you're being, chased by a bear, right? It's the same thing that's turning on. We can't discern that, right? Our amygdala does not discern that. So a lot of times these physical symptoms will be what you start to hear about more, and the kids will complain about more regularly. So stomachs or headaches, nausea, so feeling like they can't, they're going to get sick, frequent trips to the bathroom, so just the need to pee a lot or to be in there a lot. Tightness or pain in chest, right, is a stress-related one that many adults will complain about, but some children as well. Sweating, right, so just over sweating, kind of that's again that scared section of our brain is getting turned on. Dizzy or lightheadedness, and a lot of people will come to me worried they're going to pass out. However, usually the dizziness or lightheadedness, when it's caused from a revved up physical symptom, you won't actually. Heart racing, which can be really scary for a kid or even a young teen. And so most important is if you're having a kid with these symptoms, there's obviously two. The long road would be starting to reduce the stress or anxiety that's going on in their life, right? The short road is let's figure out, because many times I have kids who are freaking out before they go to school, or before they have to play in that soccer game, or before they're going to a birthday party or saying hi to a friend, right? So what are we going to do when we're having these anxious situations? Most important, and all of us adults, I would say 90% are guilty of this, is we talk too much, right? I know it's just a natural reaction. I even saw it this morning with my husband when we're trying to get the kids out the door, and he's explaining why they need to leave. And I'm like, they're not listening. They're running around and rolling on the floor, right? So listen, don't talk a lot. Try and be that calming influence. Now, again, am I always calm? Absolutely not, right? But how can you start to be? And if you can't be that calming influence in that moment, that's actually okay. Is there someone else in the house? Is there an animal you can point the kid to, or, look outside and look at the birds, but figure out how you can be that calming influence. Because we know if one person's freaking out and the other one's freaking out, it kind of compounds each other, right? Again, this is all easier said than done, and it sounds very simple, but it works beautifully well. So don't talk a lot, be calming. And if someone's experiencing the physical symptoms, a lot of times the nausea one is a scary one for kids. Am I going to throw up? I'm worried about throwing up. Remind them that it will end, that these symptoms come and go. And, obviously grounding is one technique which brings you back to your body, physical symptoms. Another technique would be just riding it out, right? Just reminding you that it ends. The quicker that you just kind of give in to the feelings, the quicker they tend to end, actually. So, again, we'll go into a little more detail. What do you do if your kid is kind of flipping out, whether it's a full panic attack with physical symptoms, or they're just talking or screaming or yelling, like I was saying, that irritability. That's a real common presentation for kids that are stressed or anxious. So as we said, anxiety is signaling that something's up. So let them know in those moments when they're like running around, like, you got this is okay. Like, I think this is stress or anxiety. Starting to identify it will help the kid know, right? Like, they'll be like, oh, I'm anxious versus, oh, I'm dying. Because it does feel like you're dying, or it feels like the world is coming to an end when these things are happening. So anxiety is a signal that says something is up. So you can just say that to whoever is stressed out in those moments. Can I help you? Right? Is there a moment? Or if they're like, no, do you want to call a friend? Would that be helpful? Let's go for a walk. More importantly, these are normal and will pass. So our body was made to detect stress and anxiety. We really want to try and address it as much as we can in the moment, but sometimes we can't fix it, right? Someone has sent us a nasty text message. I'm not talking about my adult friends, don't tend not to do that, but I'm saying, even my 10-year-old will sometimes get weird text messages, right? Real messages from friends, or friends say things at school that are harmful or hurtful. We can't fix that someone did this, right? But how can we start to calm down and think about it in a more rational or balanced way, right? And that's what we're going to do. Also, obviously, a top on the list for my middle school and high schoolers are exams. They're stressed, right? Or even, a current client of mine has to interview. Hold on. Let's see. I don't know what just popped up. There we go. One of my patients have to interview for schools next year for high school, right? And they, need help just rehearsing what they would say, because in the moment, a mind might go blank. And so rehearsing might really help, right? So if you're in an exam and your mind goes blank, or you're about to give a presentation, I always say, calm down the body, right? That's our big one. If we can do some breathing, that would be helpful. If we can take a walk or run to the bathroom to calm down, that would be helpful. Reminding yourself, overriding why using this front part of our brain, telling your brain that it's okay, even though that bottom part of our brain where our amygdala is saying this is dangerous. This is a big exam, or this is important homework. You'll be in trouble if you don't do it. Reminding yourself, I'm okay now, right? This is an okay thing that's happening. I'm not in danger. Again, it's different if we're in danger. We would approach it a different way, but this is more when we're not, in like imminent danger, right? Then hopefully your brain will come back online. So really talking yourself up. I always use the example for kids of, they've usually seen their favorite musician or athlete, or maybe even YouTuber. I'll have to do research on that because I know YouTubers are big. Like, before someone performs, they got to calm down. You see all those famous musicians. How do they calm down, right? Or famous athletes. That's why I really enjoy using like the Olympics is a great one to find, different pictures of people, how they get pumped up before they have to do something stressful. Everyone's got to do it. Now, the Olympics is different than an exam, but it isn't, and it isn't. Depends on someone's mind. So how do we address stress in the school setting in general? This is really towards the parents, caregivers, and also to teachers or school staff, right? We want to be sensitive, right? That can mean just listening. You don't have to agree with the kid either. You can think that their worry is kind of not one that would pop into your brain, but being sensitive just means sitting and listening. We're telling them it's okay, right? Doing what you're doing right now. Get educated on the difference between anxiety, stress, and worry, and how do we deal with each one of those, right? Give positive feedback. In general, as we all know, most of us are hard on ourselves. Kids are hard on themselves. There's enough information out in the world, or pressures in schools that are in all school districts, right? That pressure to do well is out there. So giving positive feedback is terribly helpful. Being consistent. So whatever we decide to do, or however we decide to interact with the kid, trying to keep that consistent is very helpful. Also for parents, right? Or caregivers, where they're saying that, oh no, you need to go to school. Making sure that unless whatever the rules is for your house, but in general, it's like you don't have a fever and don't have a couple other symptoms, you have to go to school. So being really consistent with when and how kids go to school. Focusing on problem-solving skills. We'll go through that in detail in a few minutes on how do you really teach problem-solving skills. Because remember, the kids, the front of their brains are not that formed yet. So we have to really teach them the skills that we may already inherently have as adults. And guide the kids to others for support. Don't have to do this all on your own, right? If it's that preferred coach, that preferred religious leader, that preferred friend, that referred counselor or teacher, try and find those people in the school or outside the school where your kids can go to, right? So really, as the caregiver or even as the teacher, don't accommodate too much. So if the kid is scared of something that they need to do, though, on a regular basis, let's not let them do that or avoid. So when you accommodate, you make things easier, but to a way that is almost too easy. An example might be, you have a high schooler, right, who through middle school you've helped, they get nervous about emailing or asking a question. Fine, you try and help them through middle school. But then as they're hitting high school, sophomore, junior year, they're not able to go ask a teacher for help or go to that counselor for advice, right? On their own, you have to prompt that more as their caregiver. That would be accommodating too much. They start to need to do things on their own. And what's interesting, and the data shows, is if we have them do more things on their own, then they tend to get a better sense of self, and then their anxiety or stress goes down. Letting them avoid too much, that's usually school or activities that they either need or want to do, right? Need or want. Single the child out. This is more typical in kids who are more socially anxious or scared. In the classrooms, kind of being like, why didn't you do your homework? Again, works for some kids. Other kids, it may really trigger them, and they may want to avoid the classroom instead of actually stay in it. And my big thing is, if we're having stress or anxiety at school, we need to stay in the school, in the classroom, right? That's a really important thing. Being too directive, we'll talk about this. Again, all of us are guilty. We try and give them the solution. We want people and kids to figure out their own solutions many times, or criticizing too much. So those are the general do's and don'ts. It's also, we want to, provide a way of having kids understand that there are going to be failures in life, right? So, or mistakes, or someone's going to make fun of them. We cannot, to not have that happen. This is more for the stressed kids who are worried, again, about mistakes or things like that. As you can tell, I'm a bit of a sports fan, so I like using sports analogies, but whatever your kid is into, again, I have to go check on YouTube. I'm sure there are YouTubers that hopefully have something about perfectionism, but whether they're an artist, music, video gamer, or sports person, right? One of my favorite quotes, right? I've missed more than 9,000 shots in my career. I've lost almost 300 games. 26 times I've been trusted to take the game-winning shot and missed. I've failed over and over again in my life, and that is why I succeed. Pretty much because he keeps going at it. And I'm sure Michael Jordan is a perfectionist. So, take this message with a bit of a grain of salt. However, the numbers speak for themselves, right? And I think it's so neat for kids who are older to see, you can make mistakes, and that's how you learn, right? That's where we really get some traction in life. When we talked about stress, so stressful events, we talked about just general anxiety. Another area of problems that can exacerbate underlying stress is excessive worry, right? And what was interesting is a study was done in 2020 on excessive worry. Now, this is a small scale study, But it's really interesting and helpful. I think, you know, if it was replicated more, it's easier to do this in adults. You're going to see adults and kids. We do these types of studies in kids, and it's challenging to get them to respond to surveys like 3 times a day. You can imagine that. I don't even respond to my text messages 3 times a day. So, but what it did show is a really interesting phenomenon, right? Is worry. Worry is, you know, this idea of us chewing on something in the future that may happen that we can't get out of our minds, right? For the typical, you know, even elementary, middle, or high school, it could be, you know, peer related stuff, right? Or school related, or just performance related, right? How people perceive you. So an EMA study is an ecological momentary assessment, which means, again, in real time, people are getting text messages to their phone, right? And so it's saying, what's your worry? And then they had to write down their worry. And then they followed these individuals for, I think, about a month, right? Oh no, over 10 days to see if the worries that they had during the day came true, right? Or what ended up happening with these worries. And the primary results were resumed that 91% of the worries did not come true. Isn't that amazing? I mean, I think we all tend to worry, but this is really powerful. And if you really sit down and think, so also in therapy or coping skills, I many times will have people write down their worry. You know, what are their worries? Sometimes it's helpful to write things down just to take it out of your head. And that's one really great skill you can use with kids. Even kids just talking out is the same thing, right? But what it showed is that 91% didn't even come true. And the most common percentage of untrue worries was 100%, meaning most people's worry, like there were none of these worries. Now, again, I would say about 10% is pretty accurate because some of the worries are going to come true. And even more, the subtle data is even the ones that did come true, it usually didn't turn out as bad as they thought, or they cope, even if it turned out as bad, they coped better, right? So what a good message for us to start to translate to our kids or our colleagues is that worry is very unproductive when it lasts for some time and it's regular. You're hearing it every week, every day, right? We worry a little bit about something that's actually very stressful, like moving or a new teacher. That's different. These are kind of the worries that pop in our head and have the same theme every day or kind of every week, usually school or socially related. So how do I want you to kind of approach, you know, dealing with stress and anxiety? Because we all speak, you know, different types of words. We all come from different family cultures. And so I want you to be true to you and your family. But there are some really good kind of basic skills. And again, that's why I go basic, because I really don't want to change people or their families. Like there's no one right way to say things. But there are a few core things we really need to do. So active listening is terribly helpful. What that is you sit back, you let the kid talk, or you let them even scream. They can be making no sense. I don't want you to think that you have to be like a deep therapist and have an answer. Just let them talk. Or if they're a kid who is complaining more of physical symptoms, right? Not talking, but you think something is up, you know, that's where you either sit down and watch a show with them, right? You give them a hug, you make a meal with them, whatever kind of fits with what time you have, and what you can do. You can draw a picture with them, just starting to connect, because many times I'll have plenty of kids come into therapy with me and they don't want to talk. That's fair. And so I might just have to sit there and draw a picture, and that's a good enough connection, you know, and then maybe they'll express their feelings, but just having that person next to them. Just like a coach, just like a sports team, you're going to practice, right? So we can't deal with stress if we don't practice how to deal with stress, right? Role playing, social situations. You know, I can't tell you how many patients I will say, oh, so what are you worried about, or what's stressing you out? They may say, oh, I can't remember. One of my patients recently was concerned about not being able to turn in all their homework. They didn't have time. They were sick for a few days. Their chronic illness got in the way, right? But they wanted to turn in their homework. And this was to a teacher that had kind of called them out before and had said, you know, asked them actually if they had finished their work in a very loving way, but and they hadn't. So the patient was very nervous. So I said, well, let's figure it out. Let's role play. One really fun thing, if you have the time, that kids do enjoy is you let them pick. So one of us is going to be the teacher, one of us is going to be you. Now, the kid can be themselves. More likely, they like you to be them. They just find it entertaining. Hopefully, you can be a little playful and pretend to be the child, and they can pretend to be the teacher, and they can practice just knowing what to say. So many kids, we all know, right? Through experience, through the frontal lobes, we know many times what to say in a situation. A lot of kids have no idea. They haven't practiced. They haven't seen it. So that's just a good, easy intervention. You can practice on the way to school, walking to school at nighttime. Obviously, social media we show is exacerbating already underlying issues many times, right? So if we are already stressed, if we already have low self-esteem, if we are already maybe on a little bit sad side or stress side, having them know that social media many times can exacerbate that, and just letting them know what it can do and also what lines you should kind of have in terms of, how much time they should be on social media, etc. Okay. Instruct adults or other trusted friends that are good buffers in difficult situations. Ideally, kids can handle things on their own, but many adults find it nerve-wracking to walk into a new school or a new job, right? That's normal. So knowing if they have a friend to go to do things with, or like I said, another trusted adult that they can see to feel calm. So knowing, again, we need more than just us as caregivers. We need lots of people to help out and support our kids. So look at it more as a team effort. What is really important? These are super important for stress. So I jump between stress and anxiety and then some worry, right? Actually, for all three of them, these are ideal. But really for stress, knowing and expecting the same thing every day is so helpful, right? Establishing really healthy routines, many times not easy, but just doing this. So we always think about our base, right? What is the base for us functioning? Sleeping, exercise, and eating, right? So making sure for sleep that you have good sleep hygiene, right? That's a great term, and I don't go into too much, but if you're having kids that are having issues falling asleep, staying asleep, or they tend to get up early, like beyond the good early, because it's good to have a kid get up early, especially if they have to get to school, is, making sure they all have their wind down routine, right? So, they get their, making this up, cup of water, they wash their face, they put on their pajamas, they have the same time between about 7:30 and 8:30 or whatever works with their family's, life. And then they're in bed, they have their book or they're not their book, their music, whatever it might be, and then they go to bed. But really I have plenty of adult patients that surprisingly are like, I don't even brush my teeth before I go to bed, or I don't do it in the morning. So we also want the morning wake up, right? To have a similar vibe, you can be a little too strict. So, trust me, like it doesn't have to be, like military routine. If it is, that's fine. But knowing that the routines just really reduce stress, because then the kid knows, oh, when I come home, I read my book, I play my Nintendo Switch, and then it's time for dinner. Again, we can't have the same every night, but having a similar can be really helpful. Check-ins. So these are, like I was saying, whether you're sitting down and drawing, you're playing cards, you're walking your kid to school, you kind of have to start the check-ins. Like, hey, what's up? Anything you want to talk about? All those kind of things, but really establishing a check-in weekly at the least, right? They can say nothing. Good. Then you did your job, but they know there's someone there that's saying, hey, we all get stressed. We all have worries. So again, like I said, really normalizing it. What do you want to, do you want to talk about anything? And knowing that it's there where you're not judging can be very, very helpful. Positive peer support transfer has been shown to be more and more helpful. You got to have those couple good friends, or like I said, they can be just kids in class. It doesn't have to be someone they have a BFF that they have over all the time, but knowing that they have other people their age that they can talk to or complain about really helps moods, right? And knowing that they're not alone with their feelings, and knowing that they have, again, someone else their age in a similar boat we're great as adults, but there's many things that either my kids or a teen, their good friend can say much better than I can. And humor. If you've got a good sense of humor in the culture of your family, try and use it. If not, it's not, a be all end all, but really making light of things can be very helpful. Not the serious things, right? Not something that's like bullying. I wouldn't, use humor in that case necessarily, but I would try and really lighten things up in general, and kids really benefit from seeing the adults in their lives being silly to a normal degree. But I tend to use humor a lot. I use it a lot in therapy and at home, except it falls flat at home. It's much better than my patients in therapy. They seem to like me better than my kids. So again, we are wired as caregivers or as teachers or as psychologists to want to come in and save, right? And jump in and make it better, right? And we really want to just provide more support than fixing, right? We want to talk less and listen more. So empathy goes so far. And that's just going, oh, that's got to be hard. Well, I'll tell you more ways you can kind of also empathize. Or, wow, you sounded scared. You just repeating back what they say is very helpful. And knowing that you're there and meeting them where they are. Acceptance. It's sometimes it's very hard as as an adult in a kid's life to hear that their friends rejected them, or that they failed an exam, or that someone close to them is sick. Like, all these things are hard, and it's not abnormal for us as adults to have that physical kind of reaction and emotional reaction. But accepting the kid where they are and not trying to change it is really helpful. What it does is it allows things for us to be more clear on what solutions are out there, right? We want to instill confidence in these kids, because when you are stressed, right, we doubt ourselves. When we're anxious, we doubt ourselves. When we're depressed, like, so any of these kind of negative, kind of emotions don't usually foster like, I got this, right? So knowing somehow saying, I have faith in you, or you can do that. You've got this. You have us around you, right? What's going on in your head is another great question. If you're trying to get at a kid that's having a hard time articulating, on top of it, if there's a hard time articulating, if you're saying, what, they're not telling me what's wrong, again, that could be a possibility, and you might have to just work on more, how do we soothe them? But if you can express your feelings more, that can be really helpful, right? Like, if you can show that you're like how you cope with stress. Like, I had like a hard day at work today. I had like 500 forms to fill out, and then I got in trouble. I got an email that I was late, and this is how I dealt with it. I felt sad, and then I did X, Y, Z. Them hearing how we cope is out loud is another way. If you're having a kid who's not divulging, many times they won't divulge because maybe they don't know what's going on. And so if they hear you start to articulate feelings, that can be helpful. And also, they can also not be as scared to share if they see that you're human and you do have your own problems as well. We're not putting our problems on our kids. We're expressing that we have them and how do we cope. Problem solving, which I'll go into detail approach in a few minutes, but teaching them how to problem solve is super important. You modeling how you reduce your stress. Mom's got to go for a walk, or like, I had to go to get this coffee break between my meetings because I needed just some time alone. Modeling and practicing your own stress reduction. And you'll continue to see this, and I know it's everywhere. Try to put limits on social media. So when someone's stressed or anxious, it's not always intuitive what to say, right? So what not to say. And these are really common ones that, like, I think all of us have probably said to someone, maybe not all of us, but I would say 90%. These are what we don't want to say, because it shuts the kid down pretty quickly or makes them feel like their stress or anxiety is not valid. Quit being dramatic. You're just being lazy. Come on, it's easy. When are you going to grow up? You're crazy. Can't you try harder or pull yourself together? I mean, I'm sure I've said put yourself together in the morning to get my kids out the door. That is not the correct response at times. These are better ones. And again, I want to leave a lot of these here so you can find which ones resonate for you and your situation. I know this is hard for you. Take time. It's okay. How can I help? That's a good one. What do you need right now? Again, if they're screaming and crying, though, I think it's more that you do that. I know this is hard for you, or take time. It's okay. Asking questions sometimes can work but many times they're too overwhelmed, if that makes sense, right? Want to talk about it? I see more than just your anxiety. And this is what I love about you. That's a good one just to kind of help them feel calm, and a little bit more at ease, and knowing that just because they're having big emotions or being stressed, that you're not going to run out screaming, even though you may feel like doing that. That is a very, very normal feeling to have as an adult, and we have to learn how to manage that, right? So really important for kids and for you is, how do we classify stress versus worry? Because we're talking about those worries that don't come true, right? And that's different than, actual stress. So when we have stress, we're going to use our problem solving skills, right? Those that I'll review in a few minutes. I mean, it's not magical skills. It's just trying to say, if we're actually having a stressor, if there's a test coming up, do we need to study? If that individual is bullying me, do I need to report something? So current problem, working with an individual that's challenging for me at work, right? That's an actual problem. That's not my worry. This individual I work with is just not doing the work they're supposed to be doing, right? Or my kid is struggling in school. Yeah, they might need extra help from the teacher or sit in a different place in the classroom. So those are current problems, are more stress related, right? So really start to figure out, ask yourself the question, is this something that's going on right now? Oh, that kid's bullying my kid? Yeah, let's figure out how to do it. But hypothetical problems. What if someone bullies me? What if someone makes fun of my haircut? Will I get cancer? What if someone doesn't like me? What if I lose my job? What if I screw up? What if my child does not do well in school? What if? Those what ifs, right? So that's really the key to understanding when we may have, when we're probably having more likely a worry. And the worry, we want to maybe, start to realize that's the time we want to write these down, or we want to talk to a counselor or a therapist or a friend, right? Because we need to get it out of our mind. And because when we have these worries, will I get cancer? If you have that in your brain, and it feels pretty real, right? And if we're not saying it out loud, it feels pretty true. So really teaching our kids that there's two different ways that stress can pop up, either as an actual stressor, and then we have a skill for that, and hypothetical problems, and we have a skill for that, right? So this is what I was talking about, our lovely problem solving worksheet, right? Which really isn't like a huge to do, right? But it is important. So kids need to first figure out what is the problem. This also may help you when you're going back to here, figuring out if it's a current problem or if it's a hypothetical problem, right? Two things. It'll help with that, and it teaches them how to do this, right? We as adults are so eager to jump in, save, add that solution, that again, at times it's really important, right? If the situation is pretty extreme or dire or in the immediate attention, we need to jump in. It's something that's a little less dire. It's more of a stressor that we can help them get through. So is there a problem? Okay, yeah, we'll say the problem is I can never finish my math homework, right? So I'm stressed about it all the time. Well, the problem is, okay, I can't finish it most nights because for various reasons. Well, what do we want? What do we want? Okay, well, I guess we want to be able to finish it, or do we want to talk to the teacher to reduce it? I think we want to finish it. Okay, so we want to finish it. What can we do? Well, this is the fun thing, I guess, brainstorming for all alternative solutions. It helps start to train kids to think more broadly. Well, you could copy your friend's homework. I'm kidding, but I'm not. Like, we are gonna, no answer is good or bad here. Okay, copy our friend's homework. We could email the teacher and ask if there's something, a book that they have that might want to read. We can get a tutor. We can go to school early. Again, we can stop by the teacher at lunch. Okay, there's 5 there already, right? We can stay after school. Okay, there's 6. We can work more on the weekends. I don't know. Again, no one wants to work more on the weekends. No, I'm kidding. But again, have those. Then what are the consequences of each choice? We naturally, as adults, not all of us, look at pros and cons, right? What might be a good reason? Okay, so well, working on the weekends. Well, I don't take extra time out of my school, but I want to be playing all weekend long. See, so having them think through things, their brains don't think through all the steps. Really, even 16, 17-year-olds don't, right? They get impulsive, they try things out. And part of it is we want them to just try things out. They're going to fail. But also, if there's really a problem in the moment, we want to help them think it through. And if you think it through, your stress is going to go down if you realize that you have more agency or more control over something that feels so uncontrollable. Which one are we going to try? Okay, let's try it. Let's email the teacher. Okay, I'll sit down and email with you. And then let's see, did that work? Was that helpful, right? It really doesn't take as long as I just spent, but it's just to kind of give you that outline. Another good thing to do with teens specifically, and some kids, it depends on the kid, depends how much they like to talk things out. If they don't like to talk things out, that's different. Then we might want to just hit emotion regulations. But let's talk about the kids that want to talk it out, or I've told you, oh gosh, they have worries. So am I confusing thoughts with feelings? This is another fantastic question to ask even yourself as an adult, right? When, let's say, we have a minor worry, like our kid is getting a D in Spanish class in freshman year. Oh my God, what if this is like the worst? Oh my God, they're not going to get into any schools, whatever your worry might be. I'm feeling scared for my kid versus an actual thought or a fact. So what evidence do I have to support this conclusion? This works very well also with social ones, right? That makes sense. So automatic thought. Again, this could be middle school and high school is probably more regularly where you're going to hear this. When I saw Danny at work today, he just passed me by and I know he saw me. I must have done something wrong. Or this could happen, obviously, at school, right? I can even give an example of my daughter was saying, oh, my good friend, Sarah, is just, she was supposed to help me on this project and she walked away in the middle of class and hung out with Lisa. And I was like, well, I don't know what was going on. My daughter came to me. Okay, I'm not sure what's going on. And I had her go to her counselor, obviously. And it was interesting. They talked it out and it seemed that that friend needed to do something because Lisa had already done something for that other kid. So just knowing, like, it wasn't even that they didn't want to hang out with Leah anymore, right? So it's true that he didn't say hi for this example, but I have no reason to believe I did something wrong. I didn't even say hi to him. So really testing out our worries, right? And we do this all the time as adults. I'm sure there's a thought that you can use as an example to give to a kid to let them know how to kind of follow this. But we all assume the worst, and many times it's neutral or sometimes positive even. What alternatives are out there for someone's behavior or something bad happening, right? Am I assuming my view of things is the only way? Yeah, we usually all do that, right? So again, we're wanting to create a broader view for us and for our kids, because stress gives you tunnel vision, right? When that amygdala gets turned on, we are not seeing all the good possibilities out there. We're only seeing what's bad, right? They kind of that idea of like walking with blinders. Am I thinking of things in all or nothing terms, right? I'm either a failure as a parent or I'm a rock star, right? So I'm either failure or I'm a rock star, right? When that's where if you're at either end of those things, most people, actually, you really can't just be all or nothing. You can't be a failure and you can't be a rock star all the time. It's figuring out that middle ground. So are you thinking in all or nothing terms, or either I'm good or bad, or either, I'm the smartest or I'm the dumbest, right? That's what I mean by all or nothing, right? We all have automatic thoughts. Again, these are thoughts that pop up right away when something uncomfortable happens or something bad happens. Our automatic thought is, that was a terrible mistake. I'll never do this right. Okay. Pretty dark, pretty negative terms, right? I'll never do this right. Well, we don't know the future. That's the good and bad thing, right? Anxiety comes from our fear of the unknown and the future, right? But overall, it might not be that bad. And honestly, if I practice things over and over again, it might get better. Another answer, that this is a common one that I've had with another one of my patients, is if I wasn't depressed, I'd probably shrug my shoulders and do what I could to set the situation right. I've seen others make this mistake and just go on with their day. That's the other thing to really acknowledge. If we are feeling sad, we're having a sad or low day, if we are feeling anxious and stressed, it's hard to see that positive or neutral. Why? Again, I think, talking to someone and talking your thoughts out can be so helpful, because they look at you sometimes like, why would you say that? And that just reaction is so, so helpful. I do like interpersonal meeting, whether you're on a Zoom call, whether you're on FaceTime, much better than texts. Texts are fine, but it's really hard to get people's emotions or other kids' emotions. So, realizing that there are always alternative ways of seeing and doing in a situation. We want to be flexible. That's the key. So the other thing to think about with stress is when we're feeling stressed, I don't know if anyone else is like this. I know it's the same for my body. My body's tired. It doesn't want to do anything, right? I don't want to move or get going, right? I don't want to get out of bed in those nice, especially now it's so cold in the morning. Oh my goodness, right? Like nobody wants, well, there are those people that jump out of bed. I am not one of them, right? But what is, by actually doing, we can really get our body moving. And this is where you, as your caregivers, as a teacher, as a coach, it's sometimes hard to get this in yourself, but this is so simple, but so powerful. So doing something, scheduling that, even though you're not a competitive swimmer, you're going to swim every day, every week. Sorry, not every day. We're not Olympic, but you're going to swim every week, once a week. And you're just going to do that over and over again, even if you don't feel like it, even if it's cold. I remember me taking my kids to swimming and they are not happy in the winter. But when they get done, it feels very good. It helps with mood. I think we can all relate to going for that walk or having lunch with that friend that really improved our mood and how we were doing. But maybe we didn't feel like doing it. And again, I think we can all relate when it's more cold out, that maybe we want to just stay in our comfy clothes versus get moving out. So actions may precede the emotional response. Really important to understand, to translate to a kid. And even if you don't want to translate that, or it's hard for them to understand that, coaching them. Like, come on, get out of bed. Like, you are their coach, you are their cheerleader to get them to do things. So they're going to not feel good many times before they actually do it, right? So as I always say, if it feels bad, do it, probably in these situations. And I don't mean like having a chocolate bar. I mean like a more healthy kind of response. Clubs, not every kid is into sports. That's totally fine. I want to really make this clear that exercise is great. Some kids just love chess. Great. That can be their thing that they're doing every other day, right? Or cards or music, right? That's our next one. Any clubs, anywhere where you can feel a sense of belonging. An interesting study was done, it was at least been 5 years ago, where they followed kids who were behaviorally inhibited. What that means is at a young age, you could tell an infant, well, more like 6 to 12 months, if a kid was okay with new things. So inhibited means if a new person came into the room, they kind of hid a little bit or got closer to their parent, versus one that would just kind of go out there. And, behavioral inhibition is a risk factor for social anxiety later in life. And what they showed was, they followed these kids from little to 18 to 25. The kids that had one of the take-home messages, there were a lot, but just to simplify it, that had some activity or some social belongingness, did much better. That's why it doesn't matter what it is to me. It's just something where they feel they can go, whether it's a religious group, whether it is Boy Scouts, but having that seems really helpful. Music. I played in the band. I have to say that probably helped me through high school. I never finished. I never stopped playing it after, but it was really a really great place to feel that connection with people. Find something to do for fun and not be good at it is so helpful. Also for all you adults, yes, please, any one of you that are perfectionists, just being able to find pleasure in little things is really, really nice. Socialization, again, you don't have to be a social butterfly. Your kid doesn't have to have a million friends, but just say they have that friend or that cousin that they like to hang out with, right? Support. Showing, and demonstrating what it's like to ask for support. Like I said, you as a adult are a really powerful at modeling for kids. So I'm having a hard time with this. Do you mind if we talk it out? Showing that. Cooking, like I said, that's more what their jam is. Baking. I have some of my patients that just love to bake. It's very soothing and very productive activity. Reading, taking a short walk, as we've seen over and over again in lots of different studies, taking that short walk, preferably, I have a hard time doing this without your phone or without connected to something in your ears, is really like a good reset. Going out to lunch versus sitting at your desk, we're talking about you, and then mixing it up, not having the same thing every day, really important. Because the brain gets used to things, and then it can sometimes be too used to the same thing. What else is really helpful that you can practice, right? I've had plenty of kids really dig different podcasts, different relaxations. There's so many neat things, apps out there, videos on YouTube that can help you and make it a little bit more fun. I remember during the pandemic, Go Zen was a big one where they help you do mindfulness meditation. Just a deep breathing, right? So in for 3, hold, out for 4. Again, I can't say it's the biggest, hit with my patients that they want to do deep breathing, but it really helps. Even you just showing it, even if it just helps you maybe in those moments where you have to be calm, that can be very helpful. Like I said, tons of different, I'm not endorsing any of these specific ones, but there's many different podcasts, meditation things, out there that can really help you practice something daily. We do know practicing daily really does have an impact on reducing stress. Progressive muscle relaxation, if you just Google that, there's plenty of YouTube videos and kind of like how you can tense and relax muscles to help. I also find it very helpful as a specific tool right before an exam, because it kind of brings you back into your body. And like one of my favorite ones is, if you all want to try and do it, is taking your shoulders, right, pinching them up high to your ears, like you're hiding in a turtle shell, right? But a lot of people with stress and anxiety hide and hold their stress there, and you can just feel that release by getting tense and relax. Can really help you just kind of get in a different mindset and your blood flowing, right? Yoga is obviously great. If kids have a hard time sitting still and don't want to do deep breathing meditation, exercise, crafts, whatever helps you kind of just slow yourself down and get into your senses and calm your body. Okay, I think we just have a few more slides, and then if there's any questions, we'll get to those. So this is us. These are the kids we see, right? We see kids at this age, at ages, 8 to 17. Not because it doesn't exist below 8, but it just seems to be how our studies work. So these are the different studies, which we can also give you a PDF of these slides, because I think there's a lot of information out there. Also, people always ask, number one, I think the Parent Resource Center is a great place to go if you have specific questions of looking for different resources, right? Specifically in your area. You can also always, call us and contact us at the National Institute of Mental Health. Again, we're in Bethesda, Maryland, which isn't too far from you all, but it depends on the traffic, as we always say, right? But I recommend Parent Resource Center. This abct.org is a great, it's the Association for Behavior and Cognitive Therapy. And that has a list of therapists that specialize in treating anxiety, depression, and stress. Also, I always say, let's start with books. These are some great books. Aboutourkids.org is a great resource that has free things about how you cope with all different types of things, whether it's natural disasters, whether it's loss of a loved one, whether it's tests. It really gives you more specific. I kind of gave you a big global picture of the different skills you would want to do. Taking charge of ADHD. We didn't even touch upon all the different disabilities and different things that can go with anxiety and stress. This is a common one, like we said, common at young ages. It's just a great book that can help guide you. ADAA.org is the Anxiety and Depression Association of America. Another great place for resources, tip sheets. Worrywise.kids. APA is the American Psychological Association. Coping Cat is also great resources on how you cope with anxiety. And this is one of the basic ones, Helping Your Anxious Kid, a step-by-step guide. So really, really helpful. So I think that's it. I don't know if we want to go back. Hold on. Let's see. And if there's any questions that we have.
Yes, Dr. Berman, we have some wonderful questions. So we'll go ahead and get started. So can you talk more about frequently going to the bathroom and how that's related to anxiety? Is it from a worry of having an accident, say younger children, or is it some unrelated anxiety actually physically triggering a child for their need to go to the restroom?
Yeah, great question. It can be either one of them, right? And this, I'll make it specific. So it's a cycle overall, right? So if you're anxious, you do have the need to pee, right? And that you do get a sense of urgency. And then if you're also anxious about having an accident, you'll go more. Does that make sense? So, if it's worry about having an accident, then, I would talk about kind of how you would handle that. Make sure the kid, and even if they don't say that that's what it is, you can still have that intervention. If you don't know, you can still just say, hey, I mean, I've said that, if you have this accident at school, go straight to the nurses. Like, I even just got a note from my kids' school saying, hey, any gently used pants, like, please bring, kids have accidents. It's not abnormal, right? Or find that person to go to. So letting them know what to do can reduce that, right? And also then just in general, they could just be anxious and feeling that urgency, that need to pee or use the bathroom, and that you'd want to work with, have a behavioral response that what I would want to do is have them, can you calm down for a few seconds? Can you breathe and start to calm your body down before you go to the bathroom? Because obviously I'm not going to tell a kid not to go, but I think you have to start to teach them how to cope to reduce that anxiety, so then they will feel less of an urge to go, if that makes sense.
No, thank you. So regarding check-ins, what are better questions to ask other than how was your day? Something that is more open-ended, will that make them talk more?
Yeah, I think so. Well, it depends on the kid, right? So I do, open-ended is obviously great. So if you just go, oh, who'd you sit with at lunch? Right. Or better is, like, I always think you start with the non-school related stuff that usually can get you your in, meaning like, oh, what was lunch like? What did you guys do? Or what was recess like? Right. Or where did you go for lunch? Right. Just so they can start to talk about those things, because going straight for the, like, how was your day? I think we've all done that as parents, and the kids know, they want to know, like, if anything went wrong. Right. So I think that's always good. Outside activities, right? Clubs. So starting there overall. Another thing is, like, I do is, did anything funny happen today? Or what was a fun, like with my littler ones, and that seems to help.
Great, thank you. So this parent is concerned about their child. They kind of mask during the day at school. They often don't connect the behavior to the stress, which is triggered with some sensory processing or schedule changing. How might this parent support the school to be more proactive as opposed to just trying to focus on the behavior?
Right. Yeah. And so and it sounds like it's around schedule change and sensory, correct?
Yes.
Yeah. So with schedule change, I mean, I am always this is where I am more of a micro, I've said to kind of sit back. With this situation, I'm a little more of a micromanager. The more the kid knows, a lot of times the better it is, right? So whether it's a fire alarm kind of thing, if it's if it's a change in schedule, or like when they go on field trips, things like that, where they have to know, I do ask for like detailed itineraries. I know it sounds funny, but I will be like that. I think is a very helpful thing. If you can get the school to give those out, give things ahead of time when they know. I mean, you always put that in the email, because otherwise they're going to be like, we can't tell you everything, but having more knowledge is usually helpful for those kids than less.
Great, thank you. So this is a first grader, not interested in playing with kids like after school. Is the school day enough social interaction, or should we be kind of pushing, should the family be pushing a little more to have some of those informal interactions with peers outside of school?
I think school is plenty. It's fine. It depends on the kid. The bigger thing that I would just check in on is, are they interacting at school? So if they have some friends that they're chatting with, if they are playing on the playground, if they are also, like, removing themselves in the classroom, removing themselves from art, all those things. I look at PE. It doesn't have to be, they have to be like the busiest, loudest on the playground, but see if that's a consistent, going into themselves. But some kids, that's enough socialization. They're done for the day. So just check like all the what's actually happening in school before I would worry about it at all. It's pretty much
Okay.
enough. It is enough social interaction.
Great. Yeah, understood. So this is around sleep hygiene.
Mhm.
What are some other things to try if there's already a bedtime routine in place? Child's waking up in the middle of the night, staying up for about an hour before getting back to sleep.
Mhm.
What might be some other things this parent might try?
Yeah, it's interesting if they have the mid waking. And I guess what the question would be, if they're coming into you and bugging you or not. But
Mm.
I guess what I would probably do, because it sounds like they're falling asleep, it's broken sleep, right? So they're getting up. Really, the one thing we don't want to do, but it's really tricky at younger ages, especially for parents, it makes it exhausting. We don't want them laying in their bed doing nothing, or we don't want them laying in their bed doing much for that hour, right? It's better for them if they find that they're up, depending on their age, they're up. Teens can do this. If they're up for more than 15 minutes, I have them get up, kind of restart their bedtime versus laying in there and just ruminating, right? So get up, go to the bathroom, have a cup of water, and then, maybe they have to get that special blankie that they love, something just soft to kind of soothe themselves, do some breaths, and then go back. But it's almost like a reboot. Does that make sense? Versus
Mhm.
getting up, laying there is the worst, or getting up and I guess climbing into your bed is also
Right.
challenging. So if you can get them to learn to reboot on their own, that would be a good skill.
Okay. Um, how might you address some of these challenges, specifically when the child is autistic?
Mm. Oh goodness. Yeah, I mean, I think well, one, it always is it always takes longer. I guess
Okay.
like
Yeah.
just being patient. It's not a quick fix. And then I think I tend to do obviously much more behavioral things versus, challenging the thoughts, things like that. Because it is very hard for children on the spectrum to have that flexibility, right? That's just inherent in the diagnosis. So I wouldn't, push them. I would understand where they were coming from, accept where they're coming from, and do more behavioral. So what can we breathe? Or do you find that blanket soothing? Or I would really focus on the behavior and have patience. But they will, they can learn all these things. It's just a little bit a different approach.
Okay. Um, how might a parent is concerned about kind of bedwetting
Mm.
and maybe just how to help maybe the child problem solve this or have some discussions around it. What might a parent be able to do to support?
Yeah, I mean, the good news I think in general, pediatricians will say is most kids will grow out of that, right? Like
Mm,
it can be a bladder issue. Like I don't want to,
sure.
so I would always check with the pediatrician if it's, that. And then I would always, remind them that it's the less you pay attention, the better. So I know a lot of people that will have like a pad on the bed and then, okay, if you had that accident, we clean up and then we just go on with our night. The less the disruption, the better for them, because if they're already not feeling great, I'm sure that this is happening. Also then like the basic behavioral stuff of like reducing their fluids before you go to bed. But again, some kids, it just takes an extra year or two, unfortunately, and I know that can impact sleepovers and things like that.
Sure.
But it is something that what I can do is just helping them relax and being less nervous can be
Mm,
helpful too.
mm. Any recommendations for games for anxious kids?
Games for anxious kids. There is, I'm trying to think, I don't have my iPad with me at the moment. Just have it close here to me. There are some ones I can send a list. Maybe we can do that if
That'd be
that would
great.
be
Sure.
better. But it's like Mindful Matters. There's a couple really good. If you just little Google mindful apps, there's all kinds for kids. You'll
Yeah.
get a
Yeah.
whole like slew of them. I tend to always pick the ones that are free because then you're not paying and the kid, if they don't like it, but there should be a good. So I would do, I think it's Mindful Matters, but mindfulness apps for kids, that's where I would go first.
Okay. Okay. Thank you. Um, so um, this this parent's particular child will make tiny animal-like sounds out of anxiety in
Mhm.
social situations. So, how can they eventually learn to maybe not make those sounds? How might you work with your child around that?
So in like a calm time, not during, all these
Mhm.
discussions you want to have, not right in the moment, right? Or pointing it out even more, right? Especially if it's socially related, like, oh, don't do that, then they like probably are going to do it more, right? It's kind of like a tick behavior. We know if you say stop it, the kid is having a tick, an involuntary muscle movement, they're gonna, they're gonna do it more. They're gonna feel more ashamed. So one, talk about it on the side. I always think, and we call it an incompatible response. So if they are making like the chirp or like meow, whatever it might be, I would have them blow out, because if you're blowing out and you're breathing, and you could even say, let's practice it at home. When I notice you're feeling anxious, I'll put my hand on your shoulder, and maybe you can practice breathing with me when we're in like a low key social. So like on a scale of 1 to 10, don't start it at like a big birthday party where they're going to flip out, but maybe, asking for something at a grocery store or at McDonald's, you help them practice at like a 2 or a 3. And in those situations, you kind of coach them. So coach them before. I would breathe with them. I wouldn't make it really loud, obviously, but having an incompatible response, that can really help break that habit.
Okay. All right. So just a couple of informational things. I guess someone, tried the QR codes and they didn't seem to be working. So I'm not sure. So I just wanted to let you know that, Dr. Berman. And then another family member is asking about whether you might share your contact information, like how might a family member touch base with you at NIMH.
And I don't have it at the end, and I'll have Kayleen talk too. So for me, it's pretty easy. It's, well, where's my name? Berman Erin at nih.gov. I guess I could put it in the chat, or
sure. Yeah.
Yeah, why don't I do that? Can I just put it right in?
Okay, great. Thank you. All right. I just did want to ask if there are any more questions. I don't have any more in the queue. If you happen to have any other questions, please do go ahead and put those in the Q&A feature. Dr. Berman has always been gracious about providing like a PDF of her slides. And so we will attach those with the email that I send out with the recorded link. So everyone will have that. I will remind everyone that we do have part 1 that is already up on our YouTube channel. So I'm probably going to go ahead and create a playlist. So both parts 1 and 2 will be together. So you all will be able to look through those and rewatch those if you want to go back and look at all those resources again. Another question, going into winter break, right? Any general tips on controlling yelling at the kids and adding to their stress? I love that question.
Thank you, because we all have that. I love that. I do think figuring out planning breaks for yourself, right? Of how you can do it, whether you have relatives that can help, whether you make sure you're dropping your kids off somewhere. I do think I don't discourage them from like having their, own time of crafts and things like that. It is very challenging to keep them busy. I think also I was gonna say lower everyone's expectations. That's not it. But saying, hey kids, when we're home alone a lot, mom might get a little bit more, dad or auntie might get a little more upset, and I'm going to go take breaks. Don't take it as a wrong thing if I start to walk away more. Because they do see it as rejecting. I know, even like, I feel like my husband, I'll walk away when I need stress, and he's like, you're not listening. I'm like, I need to walk away. So walking away, taking care of yourself, and also laying it out for the kids, I think can help a lot too.
Absolutely. Probably having some consistent structure to some extent, right?
I love that.
Absolutely. Okay. Any other questions? So a parent had asked about, kind of how might they participate, and so I just told them to certainly contact you all directly if they are interested in any of the studies. And so please do. The information is right there on your screen. And again, you'll get a copy of all of this, everyone. So please know that you can reach out at any time whenever it is certainly convenient for you. All right. Well, with that being said, one more question. All right. Oh, so actually, another parent is asking about kind of more webinars in the same vein, um, perhaps dealing with puberty, the emotional side of it, how to deal with it as a parent. Tari, thank you for asking that question. We are going to be having some webinars later in the spring. For kind of that middle high school age student, just around some of those behavioral emotional components. So stay tuned. But certainly we have a wonderful relationship with our friends at the National Institute of Mental Health. And if that is a topic, we will certainly reach out. You know, Kayleen is wonderful, and be able to reach out and see what else we might be able to provide you all. So thank you for asking that. I really appreciate it. All right. Well, everyone, thank you so much for joining us this morning. Dr. Berman, thank you once again for everything that you shared with us today. And we wish everyone happy holidays. We hope that you have a wonderful winter break, hopefully as stress-free as possible. And but thank you all again for joining us today. And we'll see you all in the new year. Goodbye, everyone. Thank you.